My name is Annette Klement, and I'm the Traditional Wellness Lead, and I have been employed at the Regional since 2021.
My name is Savanna Boucher. I am an Indigenous care coordinator, and I've been here for 6 months. So the story that I'm going to reflect on is I had met with an individual in the CAMU unit, and we were discussing her experiences with depression. I thought it would be a great time to kind of bring in the medicine wheel. So we talked about her physical well-being and what she was doing to take care of that, her mental well-being, and how she was also taking care of that. We got to the spiritual part, and she had realized, I actually don't do anything to actually take care of that part of my being. So because I work closely with Annette, I thought this would be the perfect time we bring her in. So with the patient's permission, I had, after our conversation, I had sent a referral to Annette and asked her to be a part of this patient's plan of care.
So when I got involved with the patient, we offered the patient smudging, so a traditional smudge with our medicines and that smoke. So we were able to go outside into the CAMU unit, into their outside space, and we provided that smudge as well as that drumming medicine as well. So drumming was something that she fully engaged in. When we do these traditional spiritual things, that medicine can really touch us sometimes. So you could see it working with her, right? She was active and engaged, and she participated fully. So it was a really wonderful experience to be able to provide her with those traditional medicines on top of every other service that she was receiving here at the hospital as well. The patient seemed to enjoy the smudging and the drumming and seemed very lighthearted after our session. She seemed in good spirits. So I thought it went really, really well.
So a part of my conversation with this patient was we were talking about other resources in the community specific for youth engagement and culture. One of their requests was to reach out to their mother and inform them of these opportunities. So during this time, I reached out to the patient's mother, and she had expressed her gratitude in being able to provide her daughter the opportunity to practice in culture. It's something that she does at home but has not been able to really engage with. But us bringing it in with her experience and her plan of care here at the hospital, she was able to realize that connection, and also had asked her mother that night, can I have my own smudge kit? And they were able to smudge together, which initially had brought them closer as well. So the mother was extremely grateful, and had mentioned the desire for more care at the hospital to involve traditional approaches.
So, which is important, right? We are always talking about combining those medicines together, right? Having that westernized medicine work alongside that spiritual traditional medicine. So, when we are able to provide that and we see them working well together, it just signifies how much the patients need that, and how important it is for us to be able to provide both types of medicine, that westernized medicine and that traditional spiritual medicine as well.